this pleasant man, young man, one would never say that he has got a problem with his left knee. But for his knee, he's so handsome, so active, so youthful and vibrant with colors. He's got a problem in his left knee at a very young age. Although he's only 34 years of age, his knee looks sadly enough like that of maybe a 50 or a 60-year-old person. And this is post-traumatic osteoarthritis. As you can see there, this is the normal side, and there's the preservation of the joint space on the lateral compartment of the right knee and a little bit loss of joint space on the medial compartment. Whereas on the left knee, you can see that there is uniform loss of joint space in both the inner as well as the outer half of the joint, and the axis of the joint, instead of passing through the center of the joint, is actually passing through the outer half of the joint. Now, coming down to the foot, due to his accident, he complains of very severe pain in his foot, and you can see that there are X-ray changes of CRPS or chronic regional pain syndrome. There are cysts in the talus, calcaneus, fibula, lateral malleolus, and some of the cuneiform bones. Here also on the medial side of the talus. We have done 3 Tesla MRI or cartogram of the knee, and you can see that there is total loss of cartilage in the patellofemoral joint space. There is some preservation of cartilage there, but there is bone on bone contact in the patellofemoral joint space. So obviously, with a total loss of patellar cartilage and narrowing of the main joint space cartilage, he is a candidate for a total knee replacement, although he is of young age. Knee replacement in young patients with post-traumatic arthritis calls for several decision making. Firstly, the patient's symptoms should warrant a knee replacement, and they should be motivated to undergo a knee replacement. They should understand that if at all a knee replacement is done at a young age, they may require a revision at a later age, a revision or two later on in life. Coming to the type of the prosthesis, there are many designs which are suited for surgery in young patients. Some of these are advances in material. There is the ceramic knee, which is not yet available in India, but is available in other parts of the world, in France, Italy. Then there is the oxenium knee, which is actually a ceramic coating to a metal part. It is still not available in India. Then there are knee designs itself which are suited for young patients. One of them is the rotating platform knee, where there is the polyethylene insert actually rotates. Then there is the cruciate retaining knee, where bone is not sacrificed. There is the central portion of the knee, the trochlear cut is not made, and the bone is preserved over here. Then there are important criteria for the materials. The polyethylene insert, that should be made up of highly cross-linked polyethylene or X-linked polyethylene or cross-linked polyethylene, so that it will last longer due to low wear rates. So all these criteria, material criteria, design criteria, are all important for achieving good results after a knee replacement in a young patient.
Hello, I am Francois Adriaans. I'm 35 years old. I am from the Netherlands, and I came all the way from Europe to Dr. Venkata Shalom here in Chennai, India, because I have a very bad knee, a post-traumatic arthritis knee, and the doctors in the Netherlands say that they couldn't give me the proper treatment because I was young, and they couldn't give me the total knee replacement that I wanted and needed. So I was sick and tired of all that orthopedic surgeon in Europe, and no longer more I want to be treated like a number. So I was looking on the internet and I came across the website of Dr. Makata Shalom, and only when looking at his face I saw that he was a good person and that he was the right orthopedic surgeon for me to give me the proper treatment. Now I am here, I am glad. He is a very good person and he has no problem in giving me the total knee replacement. He just gives it me, he listens to me, he treats me like a person, and yeah, I'm very glad that I came all the way here to Chennai. Then and that the doctor can operate me, and then I get a better life in Netherlands, that I can walk better, that I can work better again and stuff like that, because for being a young person with a knee problem like mine, that's no good. You can do things, you can't do the things that you want to do with your friends and stuff like that, and you're getting physical problems with yourself and things like that. I was sick and tired. I was very depressed from all that, and I decided to came all the way to Chennai to Dr. Makata Shalom to help me. And now I'm here, and I'm very glad that he can help me.